It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Welcome back. Our next guest, Dr. Danielle Margrini, pediatric sports medicine physician from Swedish Pediatric Specialty Care, talking about side strains in athletes, oblique muscle strains. These can take a long time to heal.
Oh, they can take forever. We've often read about how an athlete does not return to play because of an oblique strain, particularly in rotational sports, baseball, etc. You've seen it, I'm sure.
Absolutely. All right, here's Dr. Danielle Margrini and Shannon O'Kelly.
Dr. Margrini, welcome to Health Talk. How are you?
I'm well. Thank you for asking.
Thanks for joining us. Tell our listeners about your practice. You have a kind of a focus in sports medicine in the pediatric population. Is that fair to say?
That is fair to say, yeah. So I did my residency in pediatrics and then did some subspecialty training in pediatric sports medicine. So I see the gamut of ped sports injuries, concussion, and the like.
So you handle musculoskeletal concussions, return to play, decisions to sit or play, all that. You're helpful with parents.
Totally.
And guiding them through that process, because it can be complicated when you get in the pediatric world particularly.
It definitely can. And you realize that, kids are not always just little adults. They have their own specific pathology. They have their own injuries. And so it's really important to understand them, their growing anatomy, and really kind of curtailing your treatment to their specific needs.
And maybe we can just talk briefly about anatomy, kind of my favorite subject. You probably liked it a little bit too.
A little bit.
Yeah, exactly. So pediatric anatomy is different than adult anatomy. Let's set that up a little bit. Let's talk about bony growth, ossification, muscle growth, tendons. It's a huge process, and it can be complex when you're looking at a musculoskeletal injury. Like, is it a strain? Is it an avulsion? Did they damage some cartilage? There's a lot of things to look at in pediatrics when we talk about sports medicine.
Yeah, you're 100% right. So I would say the biggest thing about a pediatric skeleton is that they are still growing, and that physis, or the growth plate, is an area of cartilaginous cell growth. And so when you look at sort of the whole kinetic chain, your muscle, your tendon, and your bone, the bone muscle tendon unit is all very strong, but that physis tends to be the limiting factor in a lot of children. So, kiddos that are running a lot, they don't just develop Achilles tendonitis, but that pain at the calcaneal apophysis, that gets aggravated. So you can't really treat them the same way you would treat an adult. You really have to be honorable to the physis, make sure that you're taking their growth into consideration, and really kind of guiding their treatment protocols to be mindful of that.
So just for our listeners, because anatomy on the radio is different than anatomy in the classroom, right?
Yeah.
So let's describe the physis. Let's set that up, because it's a very important junction where a lot of bony growth is going on, but the bone is weak there. It's susceptible to injuries because of the growth and the growth plate, essentially. And that's the physis. That's what you're talking about.
Yeah. So if you look at most long bones, so your shin bone, your thigh bone, each long bone has a physis at the top and the bottom of the long bone. And basically, when these kiddos go to sleep every night, growth hormone is released into their bloodstream, and these physes are turning over new bone cells. And so that's typically what's just elongating our bones. So the more important part to understand is that these areas within the physis go through certain stages of maturation. And one specific zone, known as the hypertrophic zone, tends to be an area of weakness in children. And so if you're driving a lot of torque, a lot of strain through this hypertrophic zone in the cartilage, over time this can lead to overuse injuries, but also acute injuries to that physis.
And it's important to appreciate a little bit of physics here. This is, we've all seen it. You've seen it in your practice. I've seen it as a physical therapist. This is the 13-year-old that over the summer grows 5 inches, right? All of a sudden, bam.
True.
Well, that growth in 5 inches, that changes the lever arm, changes the physics, it changes the torque, it changes the muscle requirement. But let's talk about those growth stages, I guess, and that rapid growth.
Yeah. So, you have to figure the lever arm is a completely great way to visualize this, because your muscles don't have these growth plates. So all of a sudden, kids are growing in linear height, and then muscles and tendons are getting tight. And is better than I do that these kids are not sitting around couch surfing all day, especially in the summer months. They're up on club teams, select teams, maybe even doing a little too much. The days of just going out and having free play are over in a large extent. So these kids have crazy busy schedules. They play one sport year round, if not multiple sports year round on multiple teams. And so the same sort of muscles are being worked day in and day out with sometimes little to no recovery and rest. The body's amazing in that if you give it adequate hydration, nutrition, and rest, it tends to repair itself very well. But when you don't have enough time for the body to repair itself, injury can occur. And it starts very mild, but then it sort of starts to accumulate over time, and these injuries occur.
Back with more with Dr. Danielle Margrini after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
More of a conversation about oblique strains with Dr. Danielle Margrini and Shannon O'Kelly.
Dr. Margrini, thank you again for joining us. I mean, great information. I mean, you're doing a fantastic job talking about anatomy and physiology, particularly as it pertains to pediatric challenges when it comes to musculoskeletal injuries. One of the challenges out there, for some reason, just recently, we've seen a rash of oblique strains, and particularly internal oblique strains, which is tearing the abdominal muscle. Tell us about that, huh?
Yeah, so this is an interesting new sort of area of interest. And I think for a lot of people in the past, it's just always been lumped in as an abdominal muscle strain.
Good point.
But as diagnostic modalities have gotten better, we've really been able to pinpoint certain injuries and then subclassify them in particular ways. So we've been able to figure out and pinpoint these areas of injury and be able to treat them more appropriately based upon their pathology.
But what are you using to diagnose these? I mean, you're talking about, is this ultrasound and different diagnostic intervention that you have access to now?
Yeah, exactly. So ultrasound has come so far.
Yes,
I mean, leaps and bounds, and the ability to see certain structures on ultrasound now has become amazing. And it's point of care, right? So you can have one in the office, you can have one sideline. So your readiness to be able to use it is right there in your forefront. The other thing, though, is MRI. So I would say both the use of ultrasound and MRI have been substantially great in being able to diagnose these.
This internal oblique strain, this is one of these injuries that needs to be identified and treated. A lot of times it's an athlete maybe does a lot of rotation activity, a lot of twisting, turning, a hitter, et cetera, et cetera.
Yeah, so we see these most commonly, interestingly enough, on the opposite side of your pitching athletes and also your fast bowlers, which are your pitchers in cricket. These two areas, specifically these two types of players, seem to have the largest predominance of these injuries. And we think, at least in baseball players, that you're typically getting these because when you're wound up, when you're right about to early accelerate that ball over the plate, you're at your maximum torque. All that stored momentum is sort of in the core, in the trunk, and as soon as you start to torque that trunk and follow through with your pitch, the internal oblique is at its maximum potential. It's really teed up, and that's where we see these injuries occur.
And signs and symptoms in a nutshell here?
Yeah, so I think most of these players are experiencing pretty rapid onset acute pain. That's not to say it hasn't been developing over time and maybe one or two pitches is the straw that broke the camel's back, but this is probably a little bit of wear and tear over time and then it just kind of gives.
And how do you treat it? I mean, just time?
Yeah, so most of it you have to start with your physical exam because what's most important is being able to decipher, is this truly an internal oblique strain? So pinpointing the location, making sure it makes sense. And so I think the spectrum of the injury is important to diagnose because that's really going to help curtail your treatment plan as well as give you a time frame as to when this athlete can safely return to play. And a lot of these athletes need some rest up front to calm down the acute pathology, but getting them back in the gym and really structuring their physical therapy is paramount to getting them back playing and prophylactically helping them to not create it again.
Man, I'm going to say something right now. You like your job, don't you?
I do. Yeah. I really do.
That's great stuff. Thank you so much for your time.
Thank you.
That was Dr. Danielle Margrini. You can get more information at Swedish.org talking about internal oblique muscle strains. Shannon, we talked about this a little bit beforehand, but getting those strains takes a long time to get rid of. And you're right, because of the twisting and things like that.
Man, you're really good. You got a degree in kinesiology, don't you? Transition. That's exactly right, Tom. It's the torsion, it's the rotation, and the torque there in those athletes.
All right, our next guest, Dr. Nicholas Jansen, right after this on Como.